focus the relationship between COVID-19 and our mental health, looking at the fundamentals of mental health and some of the issues related to it, recognizing those symptoms with either ourselves or other people. But at the end of the day, we really wanted to provide persons with tools, coping mechanisms to deal with this current situation, because some people may not have access to mental health professionals or just struggling in their own right within their homes, dealing with staying at home orders. But here we are to try to provide some tools to help you deal with this current situation and mental health issues that may be either brought from or persons that may have developed it during the COVID-19 situation.
Okay. That's me now. The global problem. There's between 162 to 324 million people that use illicit substances at least, and that was reported in 2012. Between 16 to 39 million problem, there are actually between 16 to 39 million, and I say million problem drug users. And the information that is being shared with you today is taken from the United Nations Office on Drug, okay? And it's World Report from 2014. Some of the information will come from 2016 report on gas when I would have traveled to the United Nations special conference on the world drug problem on gas in 2016 in New York. And we got tons of information at that conference. And I'm sharing that with you so that you can have a universal view of substance use disorder, and the problems that are associated with it as we dive into the correlation between COVID-19 and what is happening in the world of substance use. And when people think about substance use, but anyway, I won't jump ahead. Let me just stay on script. Problem drug use was determined based on the number of people reported to be dependent on a substance, the number who injected substances. And you know, in the Bahamas, we don't have that high population of individuals who would inject substances, and we will share with you today the different administration of substances in the human body as well. And you know, Dr. King, with expertise working at CCAC and at SRC, Silence Rehabilitation and Community Counseling and Assessment Center, can share and will share with you her experiences and her expert view as it relates to the clientele population that she would have come across during her tenure at Silence Rehabilitation Center. The number of reporting long duration of use of opioids, amphetamines, or cocaine. And, you know, we might say we don't have an opioid problem here in the Bahamas yet, but I know in the US, there is a serious problem with opioid addiction. And they call it crisis. They call it crisis, opioid crisis. But when it came to cocaine and marijuana, you will realize that a lot of things were a war on drugs. And what we realized that the whole global situation, and especially in the Western world, what we've realized that substance use disorder is closely attached to the socioeconomic, the socioeconomic level in many of the communities. I'm trying to multitask here, trying to get people on at the same time as well. So excuse me for that. Continuing on the global problem, there's about between 8.9 to 22.4 million people injected drugs in 2012. about 13.1% of those who inject drugs are HIV positive. So you will see that a lot of persons who have been tested for HIV and who have proven to be positive, they are what we call substance users as well. And you will hear me using or utilizing the term substance use or substance use disorder, because in our profession, we do not use, we rarely use drug users or drug abuse and stuff like that, or the terminology or the street colloquialism as Joneses and all of those other kind of things, okay? About 50% of those who inject drugs are infected with hepatitis C virus. So you'll realize that a lot of persons with hepatitis C, because of the unsanitary needles and stuff that they be using, a high percentage of those that are even in the homeless population and might not be here in the Bahamas, but what we have experienced in Brazil, in many of our Caribbean countries, but mostly in North America, you'll find out that a large percentage of those individuals are infected with hepatitis C. Substance use scenario. The World Drug Report, UNODC, in 2016 estimated that 29 million people suffer from drug use disorders. Substance use caused 0.21 million deaths in 2014. And that's a high percentage of our population. Even locally, you can find that if we look in the criminal justice system here in our country, and I dare to say throughout the Caribbean, because we do have some Caribbean folks here on the call today, that 65% or more of the offender population use some form of substance during their course of criminal life, or during their course of criminal activities, and even upward to engaging in the criminal activity in which they have been incarcerated for. The World Health Organization in 2015 estimated that harmful alcohol use causes 3.3 million deaths each year and accounts for 25% of deaths in the age group 20 to 29. And what that is telling us is that a large percentage of our population consume alcohol and abuse alcohol. And it's safe to say that's one of the favorite drug of choice. Case in point, we under lockdown, we under curfew. Just when the PM had opened up the country, you would have noticed the first place, even before he would have opened up, or partially, I would say, open up the country, everybody who were using or wanted to use some form of alcohol or some form of substance was crying out, why aren't the bars, why aren't the liquor stores open up? And they were not open up for many reasons, and we will share a lot of those reasons here in this presentation today. And just when that was open up, you see, it was like the floodgate was open and everybody and their mom wanted to get some bottle of alcohol, for some reason. And with our population here in the Bahamas being more than, you can correct me, Dr. King, but my last check was a high percentage, actually about almost 60% of our population is under the age of 25. So about 60% of our population is under the age of 25. That is telling you that a large percentage of our population consume some form of alcohol. Death may be due to health complications, overdose, suicides, violence, or accidents. And if you check the accidents that happen on our street prior to COVID-19, a lot of them when they go to A&E, you'll find out that, especially on the weekends, Sundays, Saturday night, and Friday nights, you'll discover that some form of substance was ingested in their system within the last 8 to 24 hours prior to the accident occurring. So it's very important. It's very important to know that a large percentage of our population utilize substance in the form of alcohol, and that causes a high health challenge in our communities today. Global population continue. Oops, sorry. Global consequences of SUDs are far-reaching and include, and for those who are just tuning in, SUD is substance use disorder. There's a higher rate of hepatitis and tuberculosis in that population that use substances. Physical or mental health problems, injuries, and disabilities. You'll find out that substance users, they have comorbidity, they have co-occurring disorders. And so when they are treated, and this will come on later in our presentation, when they are treated for their substance, whether it's alcohol or any other form of substance, sometimes they have to be treated simultaneously with the several disorders, because some people might have diabetes, some people might have depression, some people might have a substance use. Global consequences of SUDs, loss of productivity. And if you have your population, which is about 60%, utilizing some form of substances, and they become what we call, they develop a disorder, obviously you will see low in productivity with those individuals who are supposed to be in our workforce, even in the educational system. Research have shown us that persons who take substance at a higher interval, their productivity is very much lower than those who moderately take substances or don't take them at all. Increased healthcare costs. And you can imagine why there is an increase in health costs, because all other ailments that are derived or derivatives from the substance use or the abuse of the substance or the disorder that is that comes from the substance, you'll find out that there is a high health cost, and a lot of time the country pays for this cost. Increased violence and crime. And check this out. If you go to a party today, and not today as we are under lockdown, but if you go to a party, you will notice that if there's a lemonade party and music is playing, very seldom any violence will break out if somebody spilled somebody's drink or something. But let marijuana be being taken or smoking at that party, or let alcohol be taken at that party, trust me, 9 out of 10 times, you'll discover that violence will occur at that party. So you'll see increased violence and crime occurring as substances are taken into one's body, and you are in a public domain, even in domestic violence in the home. That's why during COVID-19, the government was advised from the health officials, health authority, not to have the bars open, especially during curfew time and stay at home orders, because people try to cope with certain substances, and as a result, you can have incest, you can have quarrels, you can have fights, and the whole shebang, domestic violence. And then there's financial instability and emotional trauma faced by person using substances and loved ones. And of course, with many of the substances, there is overdose deaths, high deaths as a result of the abuse and the misuse of substances.
I'm just gonna chime in.
Go ahead.
So if you want to go back to the other slide, in essence, when we talk about substance use disorders, we're not just talking about alcohol or marijuana. We're talking about the whole spectrum. And the use of those drugs and substances causes a physical impairment to the body, but also an emotional and psychological impairment. So you will see the damages with the organs. You will also see persons who may be engaged in some aspect of substance use have more physical problems because of the coordination and other impacts of the drugs and health issues. Then you have, as Troy mentioned, the loss of productivity. But I really want to highlight looking at the violence and crime and financial and emotional trauma. So when a person is engaged in substance use, you will see a lower inhibition, and you'll also see a lot of risky behavior. You'll also see persons not being able to make appropriate judgments. You will see all of these things happening. And you will also see, as we go on, I think in the slides, the progression that where persons will use substance use as a coping mechanism, and then that coping mechanism leads to a level of addiction, where you have the financial instability. You'll also see that when a person is dealing with addiction, then there's also the emotional component and the psychological component that is a part of that addiction. A lot of persons tend sometimes to self-medicate with medication, as we're talking about dealing with emotional trauma, and that self-medication can also lead to the addiction as well. So when we are talking about dealing with coping mechanisms later on, I usually highlight the fact that coping needs to be healthy and not utilizing substance use, which can be sometimes a crutch that can lead to addiction.
The global problem continue. There continues to be an enormous unmet need for drug use prevention, treatment, care, and support, particularly in developing countries. And that is so true here in the Bahamas. We have a very limited a pool of substance use treatment providers, with SRC, Silence Rehabilitation, being the forerunner, being the major caretaker. And we have institutes like Diversion Behavioral Health Care, which is a subsidiary of the National Lead Institute. We have the BASH organization, we have Teen Challenge, and we have a few others, but very few of those, or very few of us, use the universal treatment for substance use disorder as it relates to treatment, as it relates to prevention, as it relates to support and care. And that's why it's very important for us not to try to use the information that we would have obtained back in the 80s or back in the 90s and try to apply them today. Because a lot of things, a lot of a lot of things have changed, and I will go further on and why I say we cannot. And this, go on.
You're right. There is a lot of unmet needs. I want to highlight the fact of different populations. Women, for example, especially in the Bahamas, we do not have any specific treatment for women. And so a lot of the treatment that you see will either be geared towards males or will be co-ed. So there are a lot of different issues, especially when you talk about care of children during sometimes the residential requirement, and the financial needs, and sometimes even when a person has completed a treatment, what is the aftercare? So this statement is definitely true, not only for where it was, but actually as well, it applies to the Bahamas.
Good. The DSM-5, which is the Digital Statistic Manual, right? And the ICD. Okay, and I will explain more on that. The Diagnostic and Statistical the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. And the information that we're sharing here today is basically falls under the DSM-5 and the ICD-10. And you will realize that substance use disorder is considered a mental illness. And so you have persons who saying, well, you come from such a good family and you do this and you do that, why you can't get yourself together? And then you end up with a stigma that is attached. And that's why a lot of people don't stay on the recovery line for a very long time, because they don't have support. And Dr. King will share with you how you can have that family support in that. Okay?
So,
go on.
So I should mention that the DSM-5 has shifted, and this is why we're kind of highlighting it in this presentation. Because before, when we were talking about substance use disorders or substance abuse, they were looking at the distinction between substance dependence and substance abuse. And that has changed from the DSM, or the earlier versions of the DSM, to the DSM-5. And under the DSM-5, it is now called substance use disorder. And so it'll be like alcohol use or cannabis use. And they have gotten rid of the dependence and abuse terminology within the disorder itself. But that is also looked at in the symptoms in these particular diagnoses. So it's no longer called alcohol dependence or alcohol abuse disorder. It's called alcohol use disorder. Right? Okay.
And substance in continuation, substance-induced disorders such as intoxication that can be induced by using psychoactive substances. And then you have substance use disorders, patterns of maladaptive use of psychoactive substances that lead to significant level of impaired functioning or personal distress. And that is from the World Health Organization, ICD, 10th revision of the International Statistical Classification of Diseases. And that is what ICD is the International Statistical Classification of Diseases and Related Health Problems. And it's a medical classification by the World Health Organization. And it talks about its harmful use. Psychoactive substances. It affects the body, central nervous system. And inside this presentation, I might interchange CNS for central nervous system. So you'll find the psychoactive substances that we use, or the users use, it affects the central nervous system. It changes how people behave or perceive what is happening around them. And if an individual have other disorders, for example, antisocial personality disorder, ASPDs, what the psychoactive substance does is it enhances, in a negative view, those disorders. The CNS, you have the brain, the spinal cord, and all the nerve system that is connected to the spinal cord, and that is actually controlled by the brain, which is the central, which is the bank that actually gives out the information and tells the body what to do or how it should feel and stuff like that, okay? And then we have the blood-brain barrier. And those of you on the call today who are in medical, and I think I saw my niece there all the way down there in medical school in the South. I won't call your name and tell you show up. Right on, okay, good. The blood-brain barrier, it protects against circulating toxins or pathogens that could cause brain infections, while at the same time allowing the nutrients or vital nutrients to enter the brain. Like you'll see there, we have large water-soluble molecules are blocked, while small fat-soluble molecules can enter. okay? And we'll share more in depth in this. The pharmacology studies that affect or studies the effects of medication and other substances on the body and the brain. During my studies, during my certification process, I so hated pharmacology. Oh, I hated this part, Dr. King. You know, we had these big names. I used to call them hippopotamus and elephant names as such, okay? But basically, pharmacology basically is the study of how medicine, how it affects the body, how it affects how we respond to these medication in the real world and how it affects the brain. And then we'll talk about half-life and the half-life of a substance. And that's the amount of time it takes to eliminate half of the original dose of a substance which enters the body. Other factors that we would look at, a person's age, and that is very important. The length of time a person has regularly used a substance. And when we talk about a person's age, what we realize is that when an individual starts from a very young age, there lies a drastic problem, or let me see if I can find the right word, but it creates a big problem for our healthcare system later on in life. Case in point, if an individual start taking marijuana and the reason why I'm going to use marijuana, and I'll explain more with the marijuana induced psychosis, and Doc can actually elaborate more on that. But when a young person whose brain is not fully developed start taking marijuana from a very early age, later on in life, he or she is going to have tremendous set of problems because the brain could not have handled that versus somebody who started taking or smoking marijuana in their 40s or their 50s. They will be able, in many instances, not in every instance, because it also determines your genetic makeup as well. You know, the whole biological makeup of one's body and how the body reacts to the substance that is induced within the body. And then also the length of time a person has regularly used substance. Some persons might decide, you know what, I'm going to take this substance, marijuana, case in point, or alcohol. I'll only drink when I go to a wedding, or I will only drink, and you know, they only go to a wedding once a month or once a quarter or something like that. Versus somebody who drinks, okay, oh, thank you, God, for waking me up this morning, so I'm going to take take a shot. And then middle of the day, hey, guys, it's lunchtime, let's take a shot. Then dinner time, you know, and that can spell a lot of problems as well. And we'll share how alcohol and a lot of legal substances actually can be more detrimental to one's health than the illegal substance. So factors to consider in the substance use disorder is a person's age, the length of time a person has regularly used a substance, and the amount of substance regularly used affect how the body absorbs psychoactive substances, metabolizes them, eliminates them, and your psychoactive substance alters the mood, how you feel, the thought process, what you think about certain things, your sensory, how you perceive things, what you see things to be. And if it's really there, your behavior, it really affects the behavior of the individual taking it on. Effects of psychoactive substances can be positive or negative, and we'll share how it can be positive or negative. Depend to a large extent on the type of substance used. And the reason why I say it could be positive or negative, in the mental health field, and Dr. King, you could help me with this, in the mental health field, there are some psychoactive substances that are given to patients that helps them deal with whatever mental issues or whatever mental illness that they are dealing with to help them recover. You would like to add to that?
So we have to remember that mental health is impacted by a lot of different areas, and mental illness, specifically utilizing the biopsychosocial model. We talked about that model several weeks ago when we were focusing on depression and recognizing that mental illnesses have three main areas: the biological area, the psychological, and the social area. And those particular factors also play a role when we think about substance use disorders. Interjecting any substance changes the body in a biological aspect. And you will see that persons that engage in substance use usually engage in it because it makes them feel some type of positive feelings. However, when you engage so much in that positive, there's always a downside. So there's positive as well as negative when it comes to substance use. And we also have to look at the use of substances and the impact that it may have on a person's psyche. So you might need that liquid courage. There's that positive right there, right? You're going out on a first date, you know, and you just need something just to kind of calm you down, and so you might have a shot of something, you might smoke blunt, you might do something because there is that positive aspect. But when you engage too much in something, or when you become addicted to something, then you lead to that negative component. And that is what is kind of driving sometimes persons seeking treatment because of the negative. They're no longer really fulfilled by that positive, but overwhelmed by the negative. And when we talk about treatment and utilizing treatment and medication, that is addressing the biological aspect of the biopsychosocial model. Because when you are engaging in substance use, that substance use can impact the chemicals that help the body run. So they're called neurotransmitters. And if you engage in substance use, there is that imbalance that sometimes occurs when a person is utilizing different drugs. We talked about substance-induced disorders. And one thing that we've noticed, at least I've noticed in the last several years of working within substance use here and abroad, is that persons will engage with certain substances, and then you will have what is called substance-induced psychosis. And that substance-induced psychosis is heavily based on the biological component of the substance use on the body. And so to alleviate sometimes the impact that the substance use has on the body biologically, medication is used, whether in withdrawal to manage withdrawal symptoms, but also to manage whatever symptoms that may have been presented based on the substance that was used.
And let's look at the classes of the drug classes. Here, we look at the stimulants, the opioids, which are the narcotics. The other ones are narcotics too, but we're looking at the type of opioids which are illegal, actually, on depressants, hallucinogens. The stimulants, we have the cocaine, the amphetamine, the methamphetamine, amphetamine. Nick, you see why I didn't like my pharmacology classes?
Methamphetamine.
Say again?
Methamphetamine.
Yeah, so I'm trying, you know.
Or we just call it meth for short.
Yes. Nicotine, caffeine, and then you have under the opioids, you have the heroin, your morphine, your opium, and Demerol. And then on your depressants, you have your alcohol, your barbiturates, your benzo,
diazepines.
Good. And your gamma hydroxy. Anyway, the G.
You just say, see it all on the slide. How about that?
Yes. And then on the one hallucinogens, you have your LSD, your mescaline peyote, your ecstasy, and your mushrooms. Okay. And you notice here, you didn't say anything here with marijuana, right? And you notice because see, marijuana can go actually in 3 of these classes. It can go under stimulants. It can go under depressants. It can go under your hallucinogens. Okay, and the marijuana has a street's name, the street name, some known as pot, weed, grass, ganja, and even in the US, Mary Jane. And then with the marijuana, it has, side effects of the marijuana. You could have memory loss, dizziness, breathing problems, lung infections, depression, psychosis, increased heart rate. And like I said, it's a stimulant. It can be classified as a depressant. It has all those properties. Let me put it that way. It has those properties within it. And your legal substances. Just because a substance is legal does not mean it is safer than an illegal substance. And look at the drawings there, or look at the photos here. You have a cigarette there, and you have, which is legal, and you have alcohol, which is legal. And what a lot of researchers have shown us that nicotine causes a lot of problems, cancer, and all of those things. The alcohol causes tremendous amount of problems with our young people, and our not so young people as well. And they are legal. And now they're discussing throughout the Caribbean, making something that is illegal now as legal, which has the THC, the marijuana. Okay.
I'm just grateful that caffeine is not on there. So thank you for not putting caffeine on there. Otherwise, I'll have to raise my hand.
I know, right?
But definitely those, we do need to recognize that even though that these substances are legal, it does not indicate, or legal does not equal okay. I think we have to pay attention that, as we know, alcohol is one of the most used substances for many countries, including the Bahamas. And it is legal, but alcohol use is a significant problem. It creates problems not only for the individual, but the family, the loved ones, as well as the country overall. So my takeaway for this slide is legal does not equal okay.
Right. I know I had a lot of friends when we talk about, their argument for legalization of marijuana. Well, sugar causes a lot of problems, and it gives people diabetes and all of those. So why don't make that illegal? They're the kind of arguments you will have.
Yeah, don't talk about the caffeine and don't talk about the sugar. I mean, keep it moving, okay? Because otherwise I can start feeling some type of feeling. But you're right. We justify the fact that these substances are legal, and because they are legal, we engage in those use, not recognizing that they're just as harmful as the illegal drugs.
Yes. You have some drugs do not fit neatly into a category. Cannabinoids, which is marijuana hashes that I spoke of earlier. You have cat, myrrh. A lot of you really might not know what is cat or myrrh. Other names is the chat tree, the flower paradise in South Africa is known as the Bushman tea in South Africa, okay? And in the African Great Lakes region, where Catha idolus is in some areas cultivated, it is known as the myrrh, or the mulan, or the morange, okay? And then you have dissociative anesthetics, and that's your PCPs. You have your inhalants, your solvents, your inhalant solvents, your gases, your nitrates. And then let's look at routes of administration for these substances. You have swallowing, where people pop a pill. You have snorting, where they can snort the cocaine, or even in some meth, like angel dust, they would snort those. Smoking, where they can mix the hashes, the marijuana within the cigarette form. Inhaling fumes, you can inhale fumes from the liquid paper to any type of gases just to get a certain type of feelings. So there's a lot of things out there, even in the synthetic world, that is illegal, that is legal, that persons are utilizing. Then you have intramuscular IM injection. Then you have subcutaneous or SG injection. Then you have intravenous, the IV injection, and you have topical where you rub on. Then you have the sublingual, okay? And to explain more, routes of administration, the faster the drug hits the brain, the greater and more reinforcing its effect. Speed of action, smoking. It takes, when somebody smoke a substance, it takes about 7 to 10 seconds to get that high, that initial high. Intravenous injection takes about 15 to 30 seconds to start the effect that one is looking for. Injecting into the muscles or under the skin takes about 3 to 5 minutes. In the mucous membrane absorption, those who snorting, it takes about 3 to 5 minutes. Swallowing pills takes upward to 20 to 30 minutes. And that's why, you know, like if you have a serious pain and you go to the doctor, a lot of times, if the pain is so severe, on the scale of 1 to 10 is like over 8, they will recommend you get an injection before you leave there, before they even give you the pills to take. And the reason why they give you that injection, because the route of action or speed of action is much quicker than if you go and take a pill for that very severe pain, which will take about 20 to 30 minutes. Then you absorb through the skin slowly over a long period. And usually people who would take those, they want that feeling and so forth. And that's where the half-life comes in, because how usually in many instances, if it takes 7 to 10 seconds, half of that to come out of the body. Okay, I don't want to jump too fast. Okay. I will explain this part a little further down the road. You want to say anything on this, Dr. King?
I think it's important to recognize that we're highlighting the speed of action because persons, first of all, when they're engaging in substance use, they don't want to wait too long, right? They want to get that, the feeling that they engage or they get from the substance quickly. So you'll see a lot of persons doing smoking, which, you know, you have the nicotine, the marijuana. A lot of persons don't like injecting, especially locally, but persons using injections can also have that immediate experience. So we have to be cognizant of when we're dealing with persons that may have a substance use, that they are engaging in these methods, and to pay attention to when these effects may be kicked in, especially when you're looking at eating or swallowing, for example. We're talking about, you know, marijuana and this whole conversation about legalizing it. But we have to consider that depends on how you take the marijuana and the impact it has on the body. So if someone smokes marijuana, you'll have that immediate reaction. And when you eat it, however, it's completely different. So some people may eat an edible, and at the end of the day, they don't feel anything, and then they eat some more and they eat some more. And so it's also important that as you talk to persons about substance use, that you talk about in relation to the speed of action, because some persons might just say, well, I didn't feel anything. Well, you didn't feel anything because A, B, and C. And it's also important as mental health professionals to be aware of this, so that when someone may be coming to see, because I've had clients come and see me and they're high. And so you have to be aware of sometimes the way that persons use it, the amount of time that it takes for the effects to take into place. So this is just more of a general for persons who have questions about how long certain substances take or the way that you inject them.
What is a drug? In medicine, any substance with the potential to prevent or cure a disease or the potential to enhance physical or mental well-being. In pharmacology, any chemical agent that alters the biochemical or physiological processes of body, tissues, or organisms. In common usage, a substance that is used for non-medical, example, recreational reasons, smoking a blunt, cigarette. Stimulants, it increases the activity of the central nervous system. Depressants, they decrease the activity of the central nervous system. Opioids decrease the activity of the central nervous system. And let me just put a plug here in with the opioid and the opioid crisis and why there's a lot of, because when people have a lot of pain, and whether it's for arthritis or whatever issues they might be suffering, and they have a tremendous pain, maybe from an accident as such, and they take opioid, and it can become very addictive. And they are very addictive, and they realize that the pain goes, but they still have to take it. And you see them now buying it on the side of the street, and they start mixing it with other substances. Then it becomes a really challenge, a great challenge for the healthcare facilities in their area. Hallucinogens, it produces a spectrum of vivid sensory distortions and markedly alter mood and thinking. Consequences of drug use. Individuals may suffer a range of consequences. Medical, you can end up, some medical illness, liver, kidney, lungs, a whole array of medical issues that can be as a consequences of the usage of substances. Legal, if something is illegal and you're caught with it, you can find yourself before the criminal justice system and subsequently incarcerated in a correctional or prison facility. Social, and when we talk about social, there's partying, and there's like when the bars were open up, people want to have backyard grill, and you can't have a good backyard grill for many if you don't have alcohol there for many, or some form of substance. Or there's a party, there's a graduation party, or there's a victory party, there must be some form of drugs or some form of substance at that party. Economic, and when we talk about the economic consequences, it could be personal economic, where people be street dealers with illegal substances, or it can be geopolitical, in the sense, when I say geopolitical, you have the major countries or the developed countries want to take control of the sale of marijuana. And in many of those countries, marijuana consumption can be legal, or marijuana consumption is legal. But in the developing countries, who actually grow a lot of the cannabis, the trees and everything, you would notice that they don't have the control over it. And so you have the big countries that come in and becomes an economic a war with that. Differing physiological responses in women. You have compared with men, women tend to develop physical problems related to substance use sooner, escalate to addiction more quickly, and they call it telescoping. You wanted to say something?
No.
Okay, good. And we have much of the research on women has been done regarding alcohol consumption. Newer research is suggesting that there is a similar pattern of rapid progression with illicit drugs. Studies have traditionally used male subjects. So, in the past, a lot of us as males, a lot of males were used as guinea pigs in in a lot of research studies. And just in recent times now, they're using more and more females because they realize that there's a major difference in a lot of instances. And I would figure or guess that because it's how our bodies are genetically designed, that contributes to this as well. Significant gaps remain in knowledge of physiological effects across the continuum of a woman's life. And then you have the fetal effects. Effects generally range from low birth weight to developmental, behavioral, and cognitive deficits. And that's why when a woman is pregnant, they're encouraged, be careful what kind of substance you inject into your body, read the label, because you can have damaging effect on the unborn baby. Cocaine and marijuana exposure impaired attention, language, and learning skills, behavioral problems. And that's why you see that females who are involved in substance use and they give birth, a myriad of problems comes out with that child. And then you have the meth exposure. You have the fetal growth restriction, decreased arousal, poor quality of movements in the individual. And just to put a plug in there, the meth is a synthetic drug. And you have crystal meth, you have, you have the white crystalline drug taken through, and it's taken through basically through snorting. Then you have heroin exposure. Infants born addicted, low birth rate, an important risk factor for delayed developmental. And so you'll find out that sometimes during the gestation period of a female, you'll find out that if there are some complication because of substance use, and after the birth of that child, what happens is that you monitor that child, doctors monitor that child. They have discovered that in many instances, that child developmental stages is delayed in many instances when it's compared to a child that is born from a parent that was not taken in substances. Then you have differing physiological responses. Youth. Early use of drugs increases a person's chances of more serious drug abuse and addiction. So it's easier for a younger person to become addicted or develop a disorder from the abuse. Young people also are particularly vulnerable to physical and social problems related to substance use. And like I told you earlier, and that is due mainly because the brain is not fully developed. And you notice there are different physiological responses in youth. Images, the photo here shows the images of a brain development in healthy children and teens ages from 5 to 20. And you see the cortex, prefrontal cortex, how it is developed from 5 all the way from 5 all the way down here. Then you have the top view, development from 5 all the way to 20. Drug use in the community. And I know you probably, a lot of you probably know more about drugs, than some of us who call ourselves professionals in the area. And, because to my surprise, working with primary school kids, they taught me a lot. And I thought I knew so much. But I realized I didn't know anything when I went into that classroom, because the drugs that they would have known and the effects about drugs. And that's why the education about drugs and the effects of these drugs in the community is very important, because the preventive care is really good to catch the child before they even experiment with any of the substances than wait till they already experiment with it. And drug in the community, drug use is common among all ages. When we did the high school drug prevalency survey, we found out the drug of choice in the Family Islands and in New Providence was alcohol. And you have a large percentage, especially those kids in the grade 9 and the grade 10, were using more of the substances than the kids who were in the grade 11 and grade 12 from that survey. And that was taken in 2011, 2012. And you have drug use across any socioeconomic group, whether you live in Bainstown, whether you live in South Beach, whether you live in Laifiki or Paradise Island, all use some form of drugs, whether it's illicit, whether it's legal, whether it's prescription drugs. What drugs are the people you interact with most likely to use? Yes, think about that. What drugs are the people you interact with most likely?
I don't have to think hard. I'm just saying. Alcohol and marijuana.
Coffee.
And coffee. Raising my hand. Thank you very much. I am a proud caffeine abuser.
And the family system definition. A family system is the unique interaction and relationship of family members to one another. And it's very important for families to be involved. Functional families. Functional families, you operate out of love, care, respect, and concern. So you can look at these, and it's not limited just to these points, to see if your family, while you're under this lockdown or while you're under quarantine, while you're doing curfew, see if your family operate out of love, care, respect, and concern. And I'll tell you if you have a functional family. They create and maintain order. They seek balance, skills to solve problems and make decisions. Everyone cooperates and works together. I know all of our families operate like this, right? All of our families. There's no one on this call right now today. Families operate outside of this functional segment. Have clear and noticeable boundaries. And you have rules, standards, and guidelines that are consistent. Everyone knows what to expect. Adults are close, share authority, and support each other. Members share feelings, negotiate, and disagree without fear of rejection or losing the relationship. Members offer growth opportunities for other members. And let's look at the dysfunctional families. And do not acknowledge that problems exist. We always have, what stays in this house? What happens in this house? Stays in this house. Do not talk about problems. Incest, abuse, all these kind of things because of substance use can be happening inside this house. And you keep it inside this house because this is how we roll in this family. Learn not to express emotions and needs or to take care of needs. They just sweep it under the rug. They don't deal. If somebody's suffering from depression, anxiety, you know what? Man, just go take 2 pills, go lay down, don't let nobody know that you're suffering because, the stigma that is attached. Learn how to become survivors. I survived the Gaza Strip. That's what my family was, the Gaza Strip. Become detached and lose trust. Suffer a loss of individual identity. Experience interruptions in emotional development, especially for children and youth. And that's why you see a lot of these, quote unquote, and I don't want to just use that word loosely, children who face challenges. Some call it at risk, but I like to say children who face challenges. They come from some of these, what we call dysfunctional families. And let me put it out there. In every family, there is some level of dysfunction. Now, you can disagree with me, that's up on you, but you'll find some level of dysfunction that happens at one time or the other in each and every one of our families. Focus nearly all attention on the member who is addicted, and that's what happens when somebody has a substance abuse problem. In many instances, in that dysfunctional family, all of the attention is focused on that individual. Substance use disorder in the family system. When a family member has a substance use disorder, the family system changes because all of its elements and functions are affected. You have codependency roles, and you have the enabler, you have the hero, you have the scapegoat, you have the mascot, and you have the lost child. All of these are roles that happens within the family. And as we go through this, think about it. See which role, if there's a family member that has some form of substance use disorder in your family, whether it's your immediate family or extended family, see which role that you play or some other family member play in this codependency role. The enabler protects the person with the addiction. They make excuses for the individual. They try to keep everybody happy. They don't want no fights or anything. And as far as they're concerned, it's one thing to be talking positive, and then there is another thing, you try to keep everything fine when you know there is a problem. Then there are underlying feelings of inadequacy, fear, and helplessness. Then you have the hero role. Yes, the hero. They ignores the problem. Man, he don't have a problem, man. He can handle his rum. He don't have a problem. Really tries to be successful, to be good, to help the family. You know what? I gotta work 15 hours a day. I gotta do this. I gotta make sure that when I get home, so that Papa don't be upset. I gotta make sure the bills are paid. I gotta keep everything in order. Underlying feelings of fear, guilt, and shame. And you see how these characteristics in these roles can conflict with each other. Then you have the scapegoat, rebels, make noise, diverts attention. It's sometimes seen as the problem. Underlying feelings of shame, guilt, and emptiness. So what happens is that, let's say it's a relationship between husband and wife. Husband is an alcoholic. In some instances, the wife can take on the scapegoat role. And they try to divert the problem of the father, who's actually the sick one inside the house. I'm thinking, because if I did that, if I did do that, then this would not have happened. The mascot is the entertainer, diverts attention from the real issue that is driving the disorder within the family. Makes inappropriate, sometimes hurtful jokes. Underlying feelings of embarrassment, shame, and anger. And then you have the lost child. It's a silent family member. It's careful not to make the problem or make any kind of problems in the house. Tries to stay to he or she try to say to himself or herself. And then they have this underlying issue or feeling of guilt, loneliness, neglect, and anger. And you see how mental illnesses can traverse or actually grow within the family because of one person suffering from one mental illness through substance use, and then these roles are taken on, and then these behaviors come into being. So what happens to the family when substance use stops? Stress and loss of emotional security occur from letting go of old roles and responsibilities, no matter how destructive the role. Uncertainty develops from loss of familiar roles and behaviors. Family members may have difficulty living joyfully despite loss of suffering. And this reached the slide, Dr. King.
Okay, you ready for me now?
Yes.
All right, so you can move on to my slide, or the next slide. So as we were talking about earlier, that substance use impacts different parts of a person's life, biologically, emotionally, socially. But in this slide, I talk about spiritual, where there is that emptiness sometimes, a sense of meaning, useless, feeling guilty that comes a part of the substance use. So these are the areas we try to help persons focus on. And different treatments will look at the biological component, where you have, like I talked about, the medication aspect. You will have the emotional and psychological, so the psychiatric disorders, the inability to experience pleasure. So you'll see that as part of a level of addiction, where persons have a hard time feeling fun. And so they may go back to engaging in the substance just to be able to feel kind of good about themselves for a moment. You have the social aspect, where there's the isolation, sometimes job loss, financial consequences. And like I said, the spiritual component that people are really struggling with sometimes, the guilt and not living according to a value system. Next slide. So we didn't really talk about the process in which a person might develop a substance use disorder. So I just kind of put it in a kind of visual, and there are different models explaining the stages of a substance use disorder. I would start with the recreation. So persons just using it just, on an average day, going home after a long day of work, will be drinking a glass of wine. And then that glass of wine becomes a glass of wine every day. And then eventually you'll see that glass of wine turn into a bottle of wine. And then eventually the person can't deal with life without any alcohol. So there's a progression. There is no, how should I say, clear line of these particular transition from one stage to the next. But you will see that there's definitely an increase in use. You'll also see an increase in the impact that the substance use will have on the individual's life, as well as the individual themselves. Next slide. And the impact it has on its life can be varied depending on the individual, from the community, from work experiences, financial issues, even legal issues. Persons, well, we don't see a lot of DUIs happening here for various reasons that I won't get into in this slide. But you will see persons engaging in things that will lead to legal problems. Medical issues, definitely, you will have some issues with social support. Educational history. There's some research out there that links certain educational levels to certain substance use, especially when you talk about early substance use and how it impacts a person's performance within school. The interest changes, the history of the family also plays a role. If someone in your family has a drug issue, you're more than likely to be susceptible to having a drug issue as well. And I mentioned before, the religion aspect also plays a role. You can now change it. So when you're talking about substance use, the decision to quit or not to quit, that is usually where people are facing, especially if they head into a substance use disorder. Many believe it is impossible, or many may not believe that it is possible to stop. They believe that at the end of the day, the short-term benefits outweigh the long-term problems, and eventually you'll sometimes see the shift in thinking and recognizing that the negative outweigh the positive of the substance use, and the attempt to become sober and to be living a life without the substance use usually kind of gets more on the front line of that person's mindset than staying within the substance use itself. They may also have minimal examples of sobriety or persons not engaging in substance use, especially when it comes to alcohol, because alcohol is everywhere. You go to a party, there's alcohol. You are at home having dinner, there's alcohol. You come home from a long day, the whole thing is to have some type of beer or lounge or smoke a joint or something. This is just what people typically do. And so for persons that have substance use disorders may have minimal examples within their life. They recognize that substance use leads to fun. And without substance use, there is no fun activities for them. And I put that in quotes. Mm-hmm. And so there is also that aspect that may not encourage them to stop whatever the substance use that they're doing. The fear of withdrawal symptom is also a significant drive for persons, especially when they are biologically dependent on the substance. Some of the withdrawal symptoms of the classes of drugs can be deadly. It's a difficult place to sit when you're thinking about the withdrawals of a substance use and your long road of being sober. And then there's a whole thing that they always say to us, person, places, or things. And at the end of the day, changing your person, place, or things, your people, places, or things can be daunting. When your whole circle is using substances, when your whole life is about your substance use. That is meaning that you have to literally start from scratch. And that in itself can be very traumatic for some people and a very hard place to decide to walk away from the substance use.
And in our group therapy program, when we're talking about how to quit and coping mechanism, and if we find out, if the client discover that, some of the people or some of the places or things are trigger for them lapsing, then they have to find, or we help them to develop coping strategies to deal with these people, places, and things so that it would not become a trigger for them.
And so when a person finally decides, or any type of behavior change, this is a model that people use. It's called the stages of change. And this is, people tend to put it in addiction, but it can be with any behavior change. So I will even put it in the COVID-19, looking at how do we change eating habits, for example, right? So we may not think that there's anything wrong with our eating, and therefore we're in the pre-contemplation. Nothing is wrong. Our eating is fine, right? Then we're on lockdown and we hop on the scale and the scale says whatever number. Then we continue to eat the way that we're eating. And the scale seems to be increasing, right? So we start to think to ourselves, maybe my eating is a problem or my diet is a problem. And then you move on to the next step where you have the preparation, where you say, okay, this is a problem. It can't be that picture where you see on social media before COVID and after COVID. So this is what I'm going to do. I'm going to stop buying so many carbs. I'm going to buy more fruits and vegetables. And I'm going to start to exercise. Even on lockdown, you can exercise, okay? YouTube, free videos all over the place, Zoom, gym meetings, the yard, all of these things. Jumping jacks still exist, okay? So you do all this preparation. Then, now this is sometimes the hard step. You have prepared yourself. You have done all of this research. You probably have pages of things you need to do after you've done this whole information gathering. The hard part is now applying that information to the action. And so the action step is where you now apply all of that, not going to the food store and buying carbs, yet your cart looks like, you're going to be making some salads, you have your lean meat, all of these things, and you have the schedule to go and exercise on a daily basis. So this is great. So you're in your action stage, and then guess what? Which is a wonderful thought that I'm about to say. COVID-19 is over. Yay, right? So you've done all of these wonderful steps. You've gone through pre-contemplation, contemplation, preparation, action. Now, you're hoping not to go back to your old ways before COVID-19, but you want to maintain. So even after COVID-19, you're going to maintain your good eating habits as well as your exercise regime. And this is where the maintenance stage comes in. A lot of people that are in addiction go through these stages. And I can even put it into an addiction. But what tends to happen is that there is a lot of myths out there about substance use. I think it might be in my next slide. It's my next slide. Oh, no, it isn't my next slide. So sorry. So even through all of these stages, there's a lot of emotions that people go through. And you will see a part of that maintenance stage. Sometimes you'll see a model that has relapse and that the person goes through the cycle again and again and again. Relapse is not a guarantee. I know a lot of people say that it is, but it isn't. It is a high percentage of people that engage in relapse because maintenance is kind of hard. And then life changes and other things happen, and we're more likely to go back to old, sometimes bad habits when that happens. But we have this cycle of emotions that we go through, especially when we're talking about behavior change. You might have the anxiety, can I cope? Then the happiness, you know, something is going to change, you know, you feel motivated. Then the fear, what impact will this have? How will it affect me? Then there's the threat. This is bigger than I thought. Or basically, it is harder to lose weight than I thought. Or it's harder to quit than I thought. It's harder to manage my anxiety than I thought. And then you go on to the guilt. Did I really do that? And you'll see this when people engage in some lapses where they have a glass of alcohol or smoke a joint. And so they recognize, wow, I fell down. And there's that guilt that comes a part of it. Then there's the denial. Change? What change? I don't need to change. So you'll see that happening in the pre-contemplation, where the people are like, I don't have to change. Like, everything's fine. Disillusionment. I'm off. This isn't me. What's going on? Why I'm not feeling myself? And you'll see this happening, especially in the early part of the addiction, where the individual is not feeling the pleasure, they're not feeling themselves. And I usually say that persons that are dealing with addiction, they've lost themselves in the addiction. And in the recovery component is not only a recovery from the addiction physically, but is also a recovery within themselves of who am I now without my substance use. There's that gradual acceptance. And you'll also sometimes see hostility. You've had people challenge, you know, the treatment. You don't know how to do this. You've never experienced any addiction and all of this kind of stuff. Like, how could you tell me what to do? So it becomes this whole cycle that people go through. So it's not just one emotion through this journey, it's many emotions. And depending on where that person is, you will see them being motivated. You will see sometimes them feeling down on themselves, sometimes guilty. And so there's this whole roller coaster of emotions as they're dealing with the substance use, as well as trying to treat the substance use itself. Next slide.
Also, you want to explain the difference between lapsing and relapsing?
I can let you do that. You want to do that? Because different people have different opinions about those terminologies. And so for me, I don't want to get so wrapped up in the terminology itself, but a lapse is just a moment.
Right.
A moment where a relapse is something is longer than, you know, it could last for days, weeks. Yes. And so when we are talking about a lapse, it's just like, you know, I'm having a shot. Mm-hmm. Whereas a relapse is I'm having bottles upon bottles for several days of alcohol.
And the reason why I wanted to say that, because you have some counselors who might be in the group here and some professionals in the group here that they might be dealing with persons who might have some form of substance. And so for them to realize that lapse and relapsing is a part of the continuum of care, is a part of their recovery process. So just like somebody who have diabetes and their sugar level goes up, or they ate something they should not have eaten, it should be treated the same way as the same way you treat a medical, you should treat persons with the substance use disorder.
So one of the things that usually drives sometimes addiction, as well as persons not being supportive of people that are in treatment, is our thoughts about it. Some people will say, well, why can't they just stop? Let me just say addiction is not a choice. That is definitely a myth. There is some control that a person has, but let's not forget that when we talk about substance use disorders, there is this biological component to it, where the body needs this particular substance. Think about you living your life without water. Can you manage that? Probably not. And so in that perspective, someone who has an addiction feels that they cannot live their life without the substances. And so it is not something that can be turned off or turned on. There is things that they have power over, and so they do that behavior change, and they do the things that they need to do in order to stay substance free. I believe you might be able to help me. There's that saying, if you work it, it works. So it means that they have to make sure that they are applying the necessary principles and the necessary steps for them to be able to manage their addiction, because addiction is a condition. Just like diabetes, just like hypertension, it is a condition. And we don't choose hypertension or diabetes, do we? No, it happens to us, and then we make behavioral changes or life changes in order to deal with them. And it's the same thing when it comes to addiction.
And, with that as well, in the criminal justice system, in what I've discovered, working with the court system, getting the magistrates to understand that addiction is a disease of the brain is very difficult, because you'll have one or two magistrates say, well, that's their choice. They decide to do it. And all we tried to explain to them is that, yes, it was their choice to take the initial substance, but when they got the disease was not their choice, but they were trying to argue the point. And that's where we still trying to have problems with them treating addiction or substance use disorder from a mental health perspective versus treating that from a criminal justice perspective. And the argument in the Western world is at that stage.
If you can go to work, you aren't really addicted. I'm not going to ask how many of you believe this statement, because, we can just keep it private. But there are a lot of people who believe that you don't have an addiction if you can work. It's called functional addiction. Mm-hmm. So yeah, I can get up in the morning and drink a half pint and go to work and do a great job, come home, or during lunch, drink another half pint, go home and drink, so there is a thing of functional addiction. I think you have to look at the symptoms and the impact that your substance use has. Do you have control over that? A lot of people I don't have a problem. I can stop when I want to stop. They put the little attitude behind it. And I'd be like, okay, I hear you, but let's make a deal. If you are unable to stop whatever substances that you say that you have power over, let me know. Come back, let's have a conversation. Because I believe that you have the power, but sometimes we don't, and it's okay. So it's recognizing that there are moments that we can function, but also still deal with mental health issues. So being able to function doesn't necessarily mean that you do not have an addiction.
And that's like hanging out with the boys, they're saying, oh, I can hold my rum. You need to learn how to hold your rum, and that's one of the things.
Relapse equals failure. So I say this not only in addiction, but I say this in any behavior change, that when we fall down, we feel like we have failed. And behavior change is extremely difficult, not only for persons that are dealing with addiction, but people in general. I know persons trying to eat healthier, persons trying to just make some behavior change within their life, recognize, hey, I went back to my old habits, and that's okay. Relapse just means that you can use it as a learning experience. It's not a failure, because we're human beings, and at the end of the day, things happen, but learning from it is the next step, and making sure that it doesn't be the end all and be all of your behavior change.
And within our organization, our mantra, our motto, we use all men fall, but the great ones get back up. You do not drown by falling into the water. You drown by staying there. And so that actually expands the fact that relapse is not failure, because you're going to fall at one time or another on the course of your life. But the failure is not falling. The failure is if you're going to stay down and don't get back up.
So overall, as we wrap up this week session, let's just talk about biological. So the detoxification aspect, medication, and the medication is sometimes used not only to help with withdrawal symptoms, but to also help persons stay in recovery. That's all I'm going to say about that.
Okay. And with medication, especially with a biological approach, in my estimation, in my professional usage, I always feel there should always be a balance of what we call medicated assisted treatment. And medicated assisted treatment always work very well in my estimation.
Lastly, I'm just gonna talk about the treatment, psychological treatment. So you have the residential options. I believe locally you have the Sandlands Rehabilitation Center, which has the inpatient option, which is co-ed. They have detox and LVU. There is a co-ed outpatient, and that's usually group therapy based. You have some local residential treatment. I think you had mentioned Teen Challenge. The Haven is one. But they're geared mainly towards the male population.
Yes, male.
I don't know of any local ones that are geared towards female only.
There was a female teen challenge that I'm not sure if it's still operational in the Bahamas, but it was not being operated by the same individuals, but a new set of individuals was supposed to bring in a teen challenge program for females. I have to check on that, see if that's still operational. And another thing was not supposed to be operational in Nassau, but I think one of the family islands.
Okay. There are also other group aspects. I didn't have self-help groups here, but you do have AA, local AA, and in the COVID-19, they have gone online. So you should be able to go to AA online and be able to locate some access to those meetings that they're having. There is the environmental interventions as well as behavioral and cognitive behavioral interventions that are part of treatment of substance use disorders. I think so. Again, this is a list of local resources, and I don't know if you want to go to the next slide, which is sad to say, because this has been fun. Even in the midst of the COVID-19, being able to share this and have conversations with those that join us. So our last session will be next Saturday. We're going to be focusing totally on coping skills. It is going to be very interactive. So we are going to ask persons that join to share how are they coping with COVID-19, what tips you want to share. We'll share ours. And we will, I guess, look forward to that. I'm going to have my toolbox of all the tools that I've been using, walking constantly around the yard and what you call it, local neighborhood. And I'm quite sure Troy is going to share his list of coping tools. And so now we're going to go into, if there's nothing else you want to say, into the question phase.
Questions, discussion, observation.
So we threw a lot of information at you guys today, but feel free to ask questions or comment on today's session or any of the sessions. Has any? I think you've all made them speechless.
I think they have their own muted. So if there are any questions, comments, observation, feel free to share.
Boy can't do that. Just like our boy calling them and tell them, okay, you got 10 these meters together. They got 10 coconut water ideas for 10 coconut water.
I don't think that's for us. Hi. Okay, so I guess there are no questions, no comments. Everybody understood the information. Those of you who, I see some folks from the Defense Force, Welfare Department, Eunice Roll, how do you guys handle, substance use in the ranks and files of the Royal Bahamas Defense Force? You can answer that, or Ms. Smith. I don't think they did all. They have their mute and their. Okay. Okay. You can wrap up, Dr. King.
Okay. It was nice spending this time with you guys this weekend. I hope the information was helpful. If you do have any questions, feel free to contact Troy or myself. We look forward to hearing from you and possibly seeing you guys next week, Saturday, same time, same place. So yeah, stay safe, stay healthy. I'm gonna pass it on to you, Troy.
Okay. Have a good afternoon, and I will see you all next week, May 16, at 1 p.m. for session 5, Coping Skills.